tell us what nasal septal perforation is?
Nasal septal perforation is something that we occasionally see in people who have rhinoplasty or nasal surgery. It's usually not seen in a normal individual, but a person who's had a very bad trauma to the nose, you know, and if they've been in a car accident or they've broken their nose in the past, or they've had repeated nasal surgeries in the past. Sometimes people who are substance abusers, like cocaine abusers, have a greater chance of getting septal perforations in the nose. But again, it's not a very common problem with nasal surgery.
Are there risks associated with surgical anesthesia?
Of course, there are risks with any procedure, and there are risks with anesthesia. But today's anesthetic techniques are so safe that you're virtually not at any risk of going through surgery with anesthesia. The likelihood of any of these anesthetic problems happening is extremely small, and the anesthesiologist who's going to be taking care of you will explain it to you in full detail before they put you under.
Can you talk a little bit about substance abuse disorders and the surgeries?
And surgery. The likelihood of having problems if you are a substance abuse, if you have abused cocaine, for example, is higher with nasal surgery. Most people do not abuse cocaine, so it's not a problem. But if you do use cocaine, you probably should mention it to your doctor, because that could cause problems with nasal surgery.
What exactly are skin contour irregularities?
Skin contour irregularities occasionally occur with any type of plastic surgery. As plastic surgeons, we deal with the skin, and sometimes they not lay right after surgery, or there may be minor deformities on the surface of the skin that could show. Most of these are related to excessive water due to swelling, for example, and most of them go away after a few weeks. But occasionally it is possible that they may not go away, and they may need a minor procedure to correct them. If it is something that is in need of correction, your doctor will tell you how it can be done and where it should be done. Sometimes it's something simple that can be done in the office. Sometimes it's something more complicated that needs to be done in the operating room. But it's very unlikely to happen, but if it does happen, it can be fixed.
Dr. Manfaat, could you tell us about sutures?
And the risk of rejection, for example?
Right.
Yeah. Sutures are obviously used in surgery. And sometimes these sutures get rejected by the body, meaning the body does not like to retain them, it cannot dissolve them or digest them, and it wants to get rid of it. When it does happen that it wants to get rid of it, it could show itself as a little bump or a little lump underneath the skin, or as a little minor infection underneath the skin. And if that happens, it needs to be taken out. When it happens, the person should just come back to their doctor and let the doctor take it out.
One of the risks of plastic surgery is an unsatisfactory result. What is your take on this?
Absolutely. With any type of cosmetic surgery, there is a slight possibility that the person may not be completely happy with the results of their surgery. But as a plastic surgeon, and most plastic surgeons feel the same way, we are very particular about our results, and we do not want to see anything less than perfect. And I'm certainly that way. And if I see there's something that I can make better for the person that I'm operating on, I'll do it. And again, it might be something small, it might be something big, but usually it's something minor that can be done in the office, and we can usually take care of it for them.
Can you tell us about the shock associated post-surgery?
Yes, shock, cardiac and pulmonary complications, these are the big or bad things that can happen with any type of surgery. Unfortunately, we don't have a crystal ball in our hand to know who is going to have these problems. But when we operate on an individual, we make sure that they're, number one, they're healthy, they don't have any medical problems, and if they do, first of all, we wouldn't operate on them. But if we don't know these things and the person has a bad problem, the worst thing that you can do as a plastic surgeon is to ignore it. So the way that I deal with these situations is that if by chance, by some stroke of bad luck, or by some unforeseen event, there was a problem with your heart rate, there was a problem with your breathing, there was some sort of a shock to your system, I'm not going to let my patient go home. I'm going to keep them in the hospital and make sure that they're safe and sound. If we need the services of another doctor, we'll be sure to ask them to come and advise us on that. For example, a cardiologist or a heart specialist or a pulmonary specialist. But again, 99% of times everything goes well and everybody's happy. But that 1% or that hundredth of a chance that something might go wrong, it's best to be in the hospital and to be safe. So that's what I do. If I feel that there's any risk to the patient, I bring them to the hospital and make sure that they're okay.
Can you tell us a little bit about medications involved with surgery?
Absolutely. It's very important not to be taking anything that is either a homeopathic remedy or a herbal medicine, or some of these people who are taking excessive amounts of vitamin, because some of these vitamins and herbal medicines and homeopathic remedies can cause you to bleed. And it's very important just to stay off of everything prior to surgery, unless it's with a specific instruction of your doctor. In certain cases, a doctor may say, I want you to take this. But 99% of times, it's best to be completely drug-free and let your own body do its work.
Can you tell us a little bit about the need for additional surgery?
Any of the complications that I've mentioned, any of the risk factors that I mentioned, they could lead to additional surgery, additional time off of work, and additional expenses for the person. However, in our office, our policy is that if you need surgery after our main operation, if there is any additional need for surgery, I would take care of that person without any restrictions after surgery. But if they need to go back to the hospital, if they need the services of another doctor, then they may be charged separately by that person. However, in our office, our policy is that we take care of the patient for that specific operation no matter what.